Well, and there's been confirmation today that the World Bank's now going to lend our government nearly $500 million to help buy doses of COVID-19 vaccines. It will be a very low-interest loan. At the moment, if I've remembered the numbers correctly, around 50% of our population, I think a bit higher than that, appears to be fully vaccinated against COVID-19. The Deputy Director General in the Health Department, the person in charge of the vaccination program, is Dr. Nicholas Crisp. Dr. Crisp, good afternoon to you, and thank you for your time. What's the money going to be used for from the World Bank?
Good afternoon, Stephen, and good afternoon to the viewers. So this is money for vaccine we've already procured, so it's a retrospective loan to offset expenses already incurred by our government. So basically it's to buy the vaccines we've already bought, so to pay for them at a much lower rate of interest than we have paid for them up till now.
Okay, so in other words, we had to take money from one area of the budget to buy vaccines. This money will then come in and replace the money that we had to spend on vaccines, which presumably in the beginning wasn't budgeted for.
Yeah, pretty much so. So this $480 million is an offset of the several billions we did spend on the procurement of the vaccines we've already received. That's other than the vaccines that were donated, obviously, because those were paid for by the donor.
Do you have to use the money for that, or can you use it for other aspects related to a vaccination drive? I'm talking about maybe paying nurses, maybe a publicity campaign, things like that, or can it only go for the doses?
So the money's already been spent, so now we just got to account for what we do with the vaccines going forward. So the way in which the World Bank works, and this is the first time we've ever had anything, well, certainly I've never worked with a World Bank loan before, and it sounds like our department and our Treasury haven't either. So it's taken a long time to understand the processes, but we have signed various agreements, various parts of the structure, where there's an environmental plan that we have to sign. There's a stakeholder engagement plan that we've had to sign. And then there's various monitoring requirements for us to report as we use these vaccines. So some of the expenses will be around how we manage the transportation, the logistics of the distribution, and so forth. So it's not purely the vaccine, but we can't use it for the staff in the health system. No, that's not part of the agreement.
All right. And I mean, this is a low-interest loan. A low-interest loan? How low is it? We've seen some loans, international bodies lending money at around 1%. You don't get money much cheaper than that, Dr. Crisp.
Stephen, I'm not actually sure. That side of the loan agreement is a Treasury responsibility. They're the only ones who actually have the authority to sign for this kind of loan, and it's part of the borrowings program of the state through the Treasury. So I'm not sure what the final agreement was, but I understand it's very, very low, yes.
I'm sure it's going to come out. We have such a slow vaccination rate. At one point it seemed to be moving quite quickly. It now seems that we're still stuck at around 50%. I realize that the fifth wave was not nearly as bad as the fourth wave, and thankfully nothing has been as bad as the second and third waves. But the fact is we still have a very low rate of vaccination. Is that beginning to worry you? The numbers just don't seem to be moving up at all.
Yeah, so Stephen, I think that obviously we would like to see a higher vaccination rate because we know that vaccination gives you a better, longer-standing immunity. But we do know that there is a fairly high immune level in the community from wild virus infection together with vaccinations. So they're variously reported between 80 and 85% of the population who has some immunity. What we really want to see is long-lasting immunity and strong cellular immunity as well as the antibodies. And for that, you need repeated exposure. So you don't want to get COVID every time there's a new variant. What you want to do is to be exposed to the vaccine so that it's in a more controlled environment. So we would prefer to have people coming more readily for vaccinations. What does make us happy is that the over 60-year-olds are now more than 70% of that population across the country is vaccinated. But it is patchy, and so there are parts of the country that are lower than 70% and others that are well over 75%. We do want to encourage people to continue to come. The vaccination program has already been integrated into the health services now, so you should be able to get vaccination in most health services, certainly in the public service, but we understand that it's difficult in some parts of the private sector who made a monumental effort to support us during the large part of the campaign.
And even if you've had the disease, even if you know that you've been exposed to it, it's still best to go and get a vaccination of both forms of protection.
Yes, for sure. So we know a lot more about vaccines and vaccination than we knew at the beginning of the pandemic. We know that's what we call heterologous boosting, nice big word for people to get their tongues around, which means mixing and matching of vaccines is still fine, and that boosting with one or other of the vaccines is a good idea. So it doesn't matter whether you had Johnson & Johnson or Pfizer, whatever vaccination site you go to, whatever they have, that vaccine that they give you will give you an improved immune response. And so we would like people to go and continue to be vaccinated and not rely on getting wild infection.
Dr. Crisp, I realize you can speak on behalf to an extent of the vaccination program at the Health Department. You can't speak on behalf of Government, Cabinet or the National Coronavirus Command Council. But if we all seem to have so much protection against the coronavirus, well, is it not time to look at removing some of the restrictions? I don't need to remind you that the Western Cape Premier is very worried about a big rugby match this weekend. He would like restrictions removed by then.
Yeah, I'm looking forward to the rugby myself, Stephen. But we've had the discussion inside the Department of Health, and we've had discussions with the Minister, who is abroad at the moment. And we do know that this is a matter for discussion with Cabinet. So I can't preempt the timeframes on that, and I can't preempt what will be decided there. But certainly we are feeling very comfortable that we can start to wind out of all the protection that we have had. That's not to say we may not need to bring some back if we get another variant, and that continues to worry us, of course. But yeah, I can't preempt the time frame.
There's a lot going on within all of this. I mean, I can't help but wonder if we just need a lot more publicity around vaccinations, if we need one last national effort, maybe before we remove the restrictions, maybe after. But we need to do something.
Yeah, obviously this is a vexed issue for us in the Health Department. We are also very concerned about HIV and TB and childhood vaccinations and all the other things that slipped during the course of the huge emphasis on COVID vaccinations and drawing our personnel into that mass program. So it's a balance. We do need to make sure that we are all adequately protected against COVID, but to pull all of our staff out of the other services now would, in our opinion, not be a brilliant idea. And it's a balance of the resources we have available to us. We really want to encourage the public, though, to find the sites that are available. There is a website available and an app that is available for finding open sites. It's being run by Right to Care. And we do have a lot of donor partners who are supporting us to make sure that we integrate this vaccination into the rest of our vaccination programs. But it is time to get on with the rest of the health service. There's a huge amount of work to do.
Dr. Nicholas Crisp, I really do appreciate the time. Thank you, Deputy Director General in the Health Department responsible for the vaccination program.